Beware, experts have suggested that men can benefit throughout their lives if they stay alert about early signs of cancer. When you recognize these signs, you would know when to visit a doctor, thus preventing the disease from progressing. There are several symptoms that can directly link to the possibility of cancer progression. There, however, are also symptoms that can be vague and you may mistake them for everyday problems. So, here is a detailed list of such signs that may or not be cancer but surely require the doctor's attention. Breast mass. Men usually do not consider the possibility of suffering from breast cancer because that sounds more like a woman's disease. Although it isn't common in men, ruling out the possibility wouldn't be wise. The symptoms include skin dimpling, nipple retraction, redness of the nipple, and nipple discharge. Pain. Early sign of cancer. Pain is an imprecise symptom, but it can be an early signs of cancer. Any pain that remains constant must be checked with a healthcare provider. Changes in testicles. Testicular cancer often occurs in men aged between 20 and 39 years. You must get checked for cancer as a part of your routine health checkup twice in a year. Besides this, if you feel any sort of swelling, lump or heaviness in the scrotum, you mustn't ignore it. Change in lymph nodes. Changes in the lymph nodes must bother you as soon as you start noticing the trouble. Lump or swelling in the lymph nodes under the armpit or neck should not be left unexamined. Fever. An unexplained fever can be an early sign of cancer. Fever may also be a sign of other common illnesses. If the fever prolongs and no doctor can tell why, you must undergo more intensive health checkups. Unexplained weight loss. It is not easy to lose weight. Therefore, an unexplained weight loss must concern you. You must visit a physician who would ask about your diet and exercise and will look for some other symptoms to come to a diagnosis. Distressing pain in abdomen and depression. If you are suffering from pain in the abdomen and are depressed, it needs to be checked. Many experts say that there is a link between depression and pancreatic cancer. Fatigue. Fatigue is also an ambiguous symptom that may or may not be pointing at cancer, but when the problem persists for a long time it is important to get it checked. Fatigue can occur in the early stages of leukemia or colon or stomach cancer. Cough. When you suffer from a coughing bout, you usually relate it to flu, cold, and allergies, but when the cough persists for a long time, i.e. for more than 3-4 weeks, it should not be ignored. It could be a symptom of cancer.